Sam Forlenza with Chronic Health Solutions, and today I just want to give a simple talk today. We just finished up one of our seminars, and I kind of wanted to show everybody a little bit about our process. And you know, we as you all know, as we focus on food sensitivities, nutrient deficiencies, and toxicities, and every week we fill these seminars, we fill our rooms up with people that have questions and health challenges concerning these issues. You know, so what you'll expect is you'll come on in. Sometimes you'll come on and run in on a one-on-one consultation, or many people want to find out more information and they'll register for one of our weekly seminar events and learn about topics. And like I always say, people put information right to use that particular evening. So we learn some great stuff here. You know, many times people don't understand how inflammation starts, and sometimes it could start out as simple achy joints and pain and being tired, and you know, and it can lead all the way up into an autoimmune response, such as thyroid problems or rheumatoid arthritis or MS, or many other things. But what usually happens is certain patients will come in and they'll we'll sit down and we'll go over their goals and take their health history and so forth, and try to find out exactly what their challenges are and how we can go about helping them. Okay. And a lot of times we find out on this three-layer foundations, sensitivities, deficiencies, and toxicities, that we'll find out when we do our specific testing is we'll start with the foods many times, and we'll find out that even though sometimes individuals are eating healthy foods such as eggs or chicken, they may be intolerant to that specific food, and we take out those particular foods that are causing this intolerance or this reaction, inflammation more specifically. Give them a master food list. Tell them, you know, help guide them on what they can eat, and to help give their immune system and digestive system a break by putting them on a master food list and help reduce the inflammation. Okay, and then they start doing well. A lot of other times people come in and they're a little bit more further down the road, unfortunately, where they've had this intolerance and they're full of inflammation, and now they have a situation what they call leaky gut. Just for instance, or for one specific reason, leaky gut is a problem that occurs through repetitive intolerances and inflammation. And what happens is many times the gut becomes inflamed, and these junctions open up in the gut. The gut's a sealed net, and these junctions will open up, allowing food particles to come in there, unabsorbed food, and cause serious reactions, sometimes autoimmune reactions. You know, with this leaky gut, proteins get directly into the blood system. Okay, and you see our immune system recognizes these bad proteins that aren't supposed to be directly in the bloodstream, and they go after it, and that's the normal response. However, after they're done fighting off these proteins, they start unfortunately going after other parts of our body that has protein, such as the thyroid tissue or joints or so forth. and they start attacking our own body. And that's what an autoimmune response is. And once again, it's caused from, many times it's caused from too much inflammation over a period of time. Just think of, with this food sensitivity, is that you keep eating the wrong food, and inflammation keeps building up. Finally, it breaks through, and causes this autoimmune response. With deficiencies, a lot of times we get people that may be gluten sensitive. Okay, they're intolerant to gluten. And as I mentioned before, gluten is a sticky protein, and what happens is it'll come into the gut. It'll actually carve out a section of the villi, and this villi is used for nutrient absorption. That's where we get all of our nutrients. And so people that have this gluten sensitivity problem, they're a lot of times, many times, they're nutrient deficient. So again, by our specific testing, we can see if you're intolerant to specific foods causing inflammation, causing your problems. So we can test and find out many problems. And last, and we also take a look at the toxicities. A lot of times people are exposed, to certain heavy metals. Even unfortunately, the food that we eat, and the colors and dyes, the nitrates that we consume, the MSGs. Nowadays, back in the day, they used to have crop dusters to spray all the crops. Well, now the seed is actually genetic engineered to contain the chemical that fights off the insects, and we're getting exposed to all these heavy metals and toxins just from the environment and the foods that we eat. So again, we base a lot on food sensitivities, nutrient deficiencies, and toxicities. And many times people that have had ailments, migraine headaches, gut dysfunction, thyroid problems, autoimmune situations, leaky gut, many times, we can clear a lot of things up. We treat a lot of children with ADHD, and nowadays there's a big connection. I'm sure a lot of parents are aware of this gut-brain connection. Whereas, like I said, these toxicities get within the bloodstream and affect behavior and could wreak havoc. And now these kids are placed on medications, that are just not fun. So we test individuals, adults and children's, and we clear out all that stuff, and we start from a good baseline. We dig down to the root, and that's what we do. We're considered functional medicine docs, and the difference is that we dig down deep to find out the root cause of the problems through our specific testing. And we'll just keep digging down because there's a reason. And unfortunately, in the standard medical realm, the insurance companies handcuff a lot of our doctors, and they're not allowed to perform they're not allowed to drill down deep, find out and order specific tests that cover specific problems. A lot of times we see people that have low thyroid, Hashimoto, another autoimmune problem, and these people feel awful. And their lab tests are within the normal range according to the medical community, but they still feel awful. And many times we can test down deeper and find some more culprits and try to help these individuals and give them the support that they need. So I just wanted to kind of talk to you guys and tell you a little bit about what we do. I say it's late in the afternoon here, and we just had a huge turnout. We have these weekly seminars. You can go to drsamclass.com. That's drsamclass.com. To register, our staff can contact you and give you more specific information. They do fill up quick. You get a full house every week. Or you can give us a call. Give us a call, and register to come on into one of our free seminars or a free one-on-one consultation. We're here to help. So I just kind of want to have a little talk with you before we went home today. And like I said, we just finished one of our weekly seminars, had a great turnout, helping a lot of people. So if you have any questions on anything, maybe you get migraines, maybe you're having trouble with weight loss, maybe you're weight loss resistant, thyroid, like I said, autoimmune, gut functions, ADHD, behavioral problems, anything that you might be having troubles with, let us know. We're here to help. Put it in the comments section. If you have a specific question, we'll get back to you and we'll answer your questions. Okay. And as usual here, if you felt that this was valuable, please share it. Share it with the community. Give us a like. If you're seeing it on YouTube, subscribe to our channel. Ring that bell so you're notified. All right, guys, looking forward to talking to you real soon. This is Dr. Sam with Chronic Health Solutions. Give us a call. The number's on the bottom of the screen here, or like I said, you can go to drsamclass.com, drsamclass.com to register for one of these seminars. Okay, we'll talk soon.